Welcome back to the Labor Lounge. I appreciate y'all for clicking on the video and tuning in with us today. I apologize about my drop schedule. I had an executive visit this week. So if you work in retail and you're in the manager level, you already know these visits are important because you only get them once every year and a half. And then whatever the results of the visit are, those are the results you're going to wear for a whole year and a half. So I had to make sure I dedicated the right amount of time to my store. If you clicked on this link, you see we're going to be talking about OZEMPIC today. So without further ado, we go get into the video and find out what the lawsuit against OZEMPIC is all about. And then we'll come on the back end and we'll talk about it a little bit more.
This morning, the manufacturers of OZEMPIC and Mounjaro, the diabetes drugs popular for aiding in weight loss, are facing a lawsuit. Demand for OZEMPIC and Mounjaro exploded as people documented their success stories using the drugs, which are approved to treat type 2 diabetes, but can also be prescribed off-label for weight loss. In the new lawsuit, a woman says she lost 150 pounds, but claims the manufacturers failed to adequately warn about the risk of gastroparesis, a condition in which the movement of food out of the stomach slows or stops. She has not been officially diagnosed with the condition.
So when I first found out about OZEMPIC, I did a video on this maybe 6 months ago now. And this is when I first got introduced to Ozempic. I realized what was going on with it, where people were actually using it to lose weight, even though it is a diabetic medicine. So the drug was created to help people with diabetes. One side effect of Ozempic, it was weight loss. So people actually started using Ozempic to lose weight. Now, rumor has it, you have the Kardashians who used Ozempic to lose weight. There's even rumors that Elon Musk used Ozempic to lose weight, and they got the results from it. So, when celebrities start using things tend to start getting abused to where I believe the FDA has even approved it to be used for weight loss in moderation. So people are actually going to doctors and they're getting Ozempic so that they can lose weight. They're using it as a weight loss, so to speak, a supplement.
Her problems have been so severe that she's been to the emergency room multiple times, including last weekend.
ABC News medical contributor Dr. Darian Sutton says so-called stomach paralysis has been seen in isolated cases, but has not been seen in large studies.
It is absolutely brutal. Patients often come in with severe dehydration and electrolyte abnormalities, and many have their symptoms are so difficult to control that they have to be admitted to the hospital.
The drugs come with clear warnings about side effects like nausea and vomiting, and a warning about a delay in gastric emptying is on the label. And the drug makers say the medication has been extensively studied. Novo Nordisk's maker of Ozempic saying gastrointestinal events are well-known side effects, adding the majority are mild to moderate and typically only occur in a short duration.
So I just wanted to pause it right there for just a quick second. So these side effects that come along with that, to me, it's almost like, well, something like this could happen from Ozempic, seeing as how we're using it for the wrong reason. The reason it was created was to help people with diabetes, and we're using it to just go ahead and lose weight. Now, I can understand how it lowers the appetite. I actually had the opportunity to speak to somebody who's using Ozempic for the weight loss portion, or the weight loss aspect of it. And I'm trying to convince her to come on to the show so we can actually sit down and have that conversation. And I would really like to unpack, like, why did she choose Ozempic to lose weight? Was this something she did because of all the results she's getting, or is she following the fact? But that's a conversation hopefully that we can have on the show. But ultimately, I'm not surprised that these type of side effects are coming from a medicine that's used for illness or autoimmune disease, and we're using it for something completely different. And I guess the more surprising part is they approved it to be prescribed to just anybody who wants to lose weight. I don't think there's any prerequisites to it.
Eli Lilly, maker of Mounjaro, tells ABC News we actively engage in monitoring and reporting safety information for all our medicines.
Now, this comes amid a new report that many employers are actually cutting off insurance coverage for similar weight loss drugs, which can cost more than $1,300 a month. They say it's straining employer-funded health care plans. So we'll see if this affects the popularity of the drugs, guys.
So that's the video. They got a lawsuit because somebody caught stomach paralysis, and I'm pretty sure more lawsuits are going to pop up as things go on. But it's just, I'm not surprised. It's used for diabetes, but we're using it for something completely different. So I'm not surprised that we're having these type of side effects. You know, I'm at the point where I just believe some people don't want to do the work. And I get it because I used to be that person. You know, you look back to almost 3 years ago now, I was way heavier than what I am today, you know, almost closer to 400 pounds. And luckily, I stumbled upon the keto diet, and that's what ultimately helped me lose the weight. I think now I'm in my lower 200s, right? So I lost well over 100 pounds, but it was hard work. And that's the part where I think people just don't want to dedicate themselves and put the discipline in place so they can actually get the results that they want to do. And I know this because I was that person. I tried all the fad diets, South Beach diet, eat 7 times a day. I've done it all, right? And none of that stuff actually, some of it gave me results, but it wasn't sustainable. When I found keto, it was very sustainable because I was still able to eat a lot of the things that I would eat anyway. I just had to cut certain things out of my diet. And then through some of the conversations I've had with people who are trying to lose weight today, the hardest part of any diet, according to them, is the fact that they don't want to feel restricted. They don't want to feel like they can go to a party and there's cupcakes on the table and they can't have a cupcake. That's one of the biggest things with dieting. So it really takes a level of discipline, and that's hard. And I think this is why people are always looking for the get rich quick scheme or the quick fix or the magic pill. Speaking of magic pill, that's a good documentary on Netflix. Go watch it. It talks about the things that we eat. But with all that being said, what are your thoughts on Ozempic? How do you feel about it? Do you think people should be using this for a weight loss supplement, or do you think that we really just need to use it for what it's intended for so we can avoid any issues going forward in the future? Leave it down in the comments, and thanks for tuning into the channel. I'll see you next time.